So your doctor tells you that you should have either a robotic or laparoscopic surgery. What is that and what's the difference? I'm Dr. Zeno. I'm a urogynecologist. Let's talk about it. So a laparoscopic or a robotic surgery are both minimally invasive ways to do surgery. That means that instead of having a big incision, usually you will have one to maybe several small incisions, potentially the size of about 8 millimeters or maybe even less, 5 millimeters for each incision. And typically we do that because the recovery is faster. There's less risks as far as recovery, risk of wound infection or other surgery related complications. And in general, people can often go home the same day or usually or potentially the next day for surgeries where people would have stayed in the hospital for several days. So lots of benefits all around. So what's the difference between the two? So robotic surgery is technically called robot-assisted laparoscopic surgery, and that's exactly what it does. The robot is assisting us in doing laparoscopy. It's a tool that we use. And so with a robot, we're using a device. Currently the most common on the market is Da Vinci, but I understand there is another one or maybe another one coming on the market. And that is a system that basically connects to small instruments and we control it at something called a console. One of the benefits with robotic surgery is that it has better visualization. It has a really powerful camera, and it also uses instruments that have more dexterity. It has instruments that really mimic more what my hands are doing if I were doing an open surgery. And so we can do more fine dissections with that. We can do harder cases with that compared to traditional laparoscopy. Traditional laparoscopy, or sometimes called straight stick laparoscopy, is where we use a similar setup with small incisions, but we're actually holding these instruments. So the instruments are usually connected to long, thin rods, and we're able to do surgeries that way. So in gynecology, some of the laparoscopic surgeries that I'll do include hysterectomy, which is removing the uterus, or myomectomy, removing fibroids, sometimes what's called a nexal surgery, which is surgery on the tubes or ovaries. And with the robot, I can do all those things as well. Plus, I typically do my sacrocolpopexy procedures that way, which is a surgery for pelvic organ prolapse. It can be done laparoscopically as well, but I would argue that on the robot, I can do that more independently, whereas with laparoscopy, you're more reliant on your team member to hold the camera or someone else to help you, assist you with the other instruments. Whereas with the robot, I can do all that through one platform. Now, the biggest misconception or myth that I hear about the robot is that I'm using something that's going to operate for me, and that could not be further from the truth. Like I said, the robot is a tool, and again, it has a platform, which is the actual robot device, and then a console where I'm sitting and controlling the robot. So without me controlling it, it can't do anything. And so yes, I am in the room. I'm not in some other room or outside the hospital or something, even though that has been done as far as like a method of telehealth, delivering robotic surgery even internationally. But that's not what's happening typically here in the States, and especially in my cases. Another misconception along with that is that the robot is doing the entire surgery, which is also not true. There's a lot of setup involved that requires a team, and the physician is the leader of that team, making sure that we're putting the what's called ports in the right place where those small incisions are to set up the robot. And then obviously, operating on the robot, controlling it, and then a lot of safety measures in place to make sure that we're doing it in a way that really harnesses the power of this tool without causing problems. So again, robotic surgery, laparoscopic surgery, great tools. Yesterday I did a robotic myomectomy. I took out 4 fibroids, the largest one about 10 centimeters. There's just no way I would have been able to do that laparoscopically. I was able to close those incisions using the dexterity of the robot and make sure that we get good control of the bleeding that way, and that it really ultimately helps the patient heal well. And also avoid, again, a large incision where, again, surgery can be done that way, but there's more risk of wound complications, infection, harder recovery overall for the patient as far as pain and things. So hope that answers any questions. And if you have any, just leave them in the comments and I'll get back to you.